Good afternoon, everyone. As I had mentioned earlier, I'm Sophia Tieno, and it's a pleasure for me to be moderating this session on sudden cardiac arrest and the importance of CPR. Our session will run from 2 to 4 p.m., and we have two speakers to emanate a few tips on how to go about cardiac arrest, or rather sudden cardiac arrest in public spaces. So we have Dr. Lara Zeyoud, who is a clinical support specialist at ZOLL Medical Corporation. Dr. Lara is dedicated to improving CPR quality and strengthening emergency response systems for both healthcare professionals and lay rescuers across the Middle East and Africa. Alongside Dr. Lara, we also have Kunal Bhatt, who is the operations director at Surgilabs Ltd. Dr. Kunal also has extensive experience in patient monitoring technologies and critical care equipment. Also, he's also a clinical application specialist who's dedicated to improving patient safety in hospitals and in public access settings. So thank you so much again for taking the time to attend the session. I hope that we'll gain experience. Thank you so much. So I'd like to welcome our first speaker.
Good afternoon. I'm Kunal Bhatt. Just to take you over an overview of Surgilabs, we're a medical supply equipment company that has been established for over 45 years. We pride ourselves in the brands we represent, choosing brands that excel in the area of their expertise, and representing some of them for over 30 years. Some of our specialities has been maintenance, calibration of medical equipment, supply of medical surgical equipment, and supply of emergency and life-saving equipment. And this is how we also came to the public access safety market as well, when we saw that for the emergency equipment is also needed outside the hospital. I will now pass it on to Dr. Lara to introduce ZOLL.
Okay, so first of all, I would like to thank you all for taking the time to join us for today's webinar. Starting with an introduction as a ZOLL company. So the name ZOLL comes from Dr. Paul ZOLL, which is recognized as the father of the modern electrophysiology, because he was like the pioneer in the cardiac pacing in 1954. And he was the first physician who were able to perform the first external defibrillation in the 1956. So who we are and where we are presented. So ZOLL is a US-based company with a headquarter in Boston. We have been active since 2015 as part of Asahi Kasai Corporation. We have more than 7,000 employees across the globe with more than 1,700 distributors. We are present in an average 140 countries through direct markets and through our distributor, just like the Surgilabs in Kenya.
My name is Vivian Boaz. I'm the Vice Chair, Workplace Safety Professionals Association of Kenya, what we call WSPAK here in Kenya. It was established in 2019, and it's a non-profit organization that's dedicated to enhancing OSH across workplaces in Kenya. And as a professional body, WSPAK fosters a collaborative network where OSH practitioners from various industries, we create an environment where they can exchange knowledge, share best practices, and advocate for safer work environments. Since its inception in 2019, WSPAK has been at the forefront of workplace safety advocacy, driving training, certification, and awareness programs to strengthen OSH compliance and culture in the country. Now, through strategic partnerships and capacity building initiatives, the association continues to empower professionals and organizations in an effort to create healthier, safer, and more sustainable workplaces across the country. It's an honor for us to collaborate on this webinar with Surgilabs and ZOLL, and I hope the members who are present gain something from this conversation. For us, it's a timely conversation as a country that is now focusing on public safety. It's really timely, If you look at companies in the telecommunications industry, so many of them are now trying to focus their CSR funds towards public safety. So I think this is a conversation that they need, and some of this equipment are some that they need in the efforts they are putting in towards public safety. So thank you so much, and back to you, Dr. Lara.
Okay, so just as a reminder, what is ZOLL Medical? So ZOLL Medical is a medical equipment company focusing on mainly the resuscitation and the ventilation part. So anything that goes through like our patients who suffer from cardiac arrest, we are able to help them through the chain of survival, which we will discuss later on during the presentation. So mainly our focus is for the hospital EMS services, like the big facilities that care for the patients once they reach these areas. But also we extend our care also for the public areas where we need, or like we see the need in the market to cover these areas to make sure that our patients who suffer from cardiac arrest have the best chances of survival and to survive with a good neurological outcome. So starting with the very funny video of Mr. Bean. So the idea is that I think we all agree that the best defibrillators are the ones that are there first. Although it's not similar to this video, but let's see. Although he did achieve ROSC and he survived, but this is not how we should treat our patients who suffer from cardiac arrest. So the problem with the sudden cardiac arrest, it's a huge public health problem with around 1 million people who suffer from cardiac arrest and die because of it. And most of them, unfortunately, are not in a such public view. So the problem with the sudden cardiac arrest is that there is a specific features or there's specific criteria that we need to follow in order to help these patients who suffer from cardiac arrest. As a start, we'll just do to look at the differentiation between what is a heart attack and what is a cardiac arrest. So the heart attack, where we have a problem with the blood supply to the heart muscle itself. So we have a plumping problem compared to the cardiac arrest where we have a problem in the electric part. So we have impulses that comes from the heart, and there is a problem with these impulses that leads to the failure of the heart to be pumping enough blood and pass it through the circulation. So the heart attack is also known as myocardial infarction. Myocardial infarction, if we want to translate this in like a simple English, we will say that it's the death of the heart muscle because of the blockage of the coronary artery, which supplied that muscle with the blood. So if we have a blockage, this will lead to the death of that muscle, and it's commonly known as a heart attack. What is the causes of the myocardial infarction? It can be genetics, diet, or even lack of exercises. What are the signs of the symptoms? The very most common signs and symptoms that we see in a heart attack is the chest pain and discomfort. You see the patient putting their hand on their left side. They feel the pain radiating to their arm, their neck, or even their jaw. The most important part is during this initial phase, they are usually conscious patients. We do have a pulse at that time. So if we check their pulse, you can see the pulse. They are still awake. And these very first few minutes, let's say, they are very critical for their condition. They need to be sent to the hospital in order to help them to unblock the artery that is causing the heart attack. Compared to the cardiac arrest, if we look into in-depth of the cardiac arrest, so as we mentioned, the heart works with two systems, a pumping system and electric system. So if we have a problem with the pumping system, we will have a heart attack. But if we have a problem with the electric system, we have the cardiac arrest. So the electric system starts from here, from the SA node, and then it scatters through different parts of the electric chain within the heart, and it leads to the contraction and relaxation of the heart muscle. And this is how our heart is pumping currently. But when the patient suffers from a cardiac arrest, this means that there is more than one point that suffers from this electric activity. So there is more than one area that initiate these impulses, which lead to in disorganization and chaotic rhythm and we are not able to generate a pulse, and there is no active blood supply from the heart. So what are the signs and the symptoms of a cardiac arrest? So the cardiac arrest occurs when the heart stops beating, as we mentioned. The very important first sign is our patients will be unconscious. Their breathing is usually abnormal and we don't have a heartbeat. So if you check the pulse, there is no pulse. And they look terribly sick. This will lead to no oxygen to the brain. Not only the brain, but to all of the vital organs that we have. Our main focus is the brain because it's like the first organ that will suffer like continuous damage if we took our time in treating the patients who suffer from cardiac arrest. What is the causes of the cardiac arrest? We have electrocution, hypoxia, heart attack, hypothermia, hypovolemia, and some toxins. So the heart attack or the cardiac arrest can lead to the heart attack can lead to cardiac arrest. How common do we see cardiac arrest, let's say per region or per country? So according to the WHO or according to the AHA, we see around 1,000 persons per day suffering from sudden cardiac arrest out of hospital. And this group of people covers a wide range. It doesn't matter what their age, what's their background, what's their ethnicity, what's their sex groups, all of them, on average, it affects everyone. And according to the data of 2020, the incidence of out-of-hospital cardiac arrest range from 30 to around 100 case per 100,000 population. So when we compare this to the current population of Kenya of 58 million, the calculated incidence would be ranging from 17,500 to 56,000 per year. So where our patients who suffer from cardiac arrest as an out-of-hospital are available and how we can assist in that part. So as you can see here, the recommendation to have the AED devices is scattered across different parts in our country. So the transport services, the manufacturer production, the leisure facilities like the gym, anywhere where we play sport, that's a place, a recommendation to have an AED device. Education covering both the hospital, covering both the schools and the universities, the shopping centers, the malls, the offices, the hotels recommendation. So we have a wide range of places where the AED is recommended to be placed in there because you never know when the cardiac arrest will hit that person. And we need to start the usage of the AED as soon as possible. So now we know what is the problem, the cardiac arrest. Now we know the difference between the cardiac arrest and a heart attack. We know how common it happens and where it might happen. The next step is what should we do once we see someone who suffers from a cardiac arrest? What's the next step? Initial treatment, let's say, or assisting the patient of a cardiac arrest. We need to perform both of things. Perform a high quality CPR and early defibrillation. So both of them are as equally important to each other. We'll start with the CPR. So CPR is the cardiopulmonary resuscitation, which is divided into two parts: cardio related to the heart, pulmonary related to the ventilation in the lung, and resuscitation is the aim to gain this back to the normal circulation as it was before the cardiac arrest. In order for us to survive, we need perfusion. This is how we are surviving. Our heart is beating, the blood is circulating to different parts in our body, to different organs, and we have the perfusion. The exchange of the oxygen and the carbon dioxide happens, and we are healthy and we are surviving. But for our patients who suffer from cardiac arrest, they lose this part, the beating heart. So we need to act as their beating heart during this crucial moments. And we do this by providing the high quality CPR. And of course, the ECMO later on. So the ECMO is the treatment that's next step. So it's like exchange of the blood of these patients. So that's like a little bit advanced, which occurs in the hospital. So for the public areas, our focus, once the patient suffers from a cardiac arrest, we need to act as their beating heart by performing a high quality CPR. So what is the criteria of a high quality CPR? So we are following the guidelines of the American Heart Association, and these are the criteria in order to achieve a high quality CPR. We need to make sure that we do the chest compression within the right position, with the right depth, the right rate, performing fully recoil and on the right surface. First of all, the position. The position should be within the 2/3 part of the sternum across the armpit line. So that's where our crossed hand should be when we are performing the chest compression. Next, the depth. The recommendation of the AHA for the depth is between 5 to 6 centimeter. So 5 to 6 centimeter is a narrow window. So it's very important to make sure that you're achieving the target area. Why the recommendation is 5 to 6 centimeter? Because a lot of studies led to this recommendation. If we are exceeding the 6 centimeter, we are causing harm for our patients. And if we are below the 5 centimeter, we are not generating enough perfusion to make sure that they will survive this cardiac arrest. Next, we have the rate. So the recommendation of the rate according to the AHA is from 100 to 120 chest compression per minute, which means the frequency of the compression that I'm doing, it should be from 100 to 120 per a minute. How did they came up with the idea to help with that part for the rate? So there's like a list of songs that you can sing in your mind while you are doing the chest compression. Following the rhythm of this song can let you achieve the right rate. So this is the list of the song. One of the very popular songs is Stay Alive. And the other one is Baby Shark, which I believe everyone know this song. If you have kids or you don't have kids, you know the song. So that's pretty easy to perform. Next, why is the recommendation between 100 to 120? Because within the studies, we saw that the highest chances of survival for the patient who suffer from cardiac arrest is when the chest compression rate is between 100 to 120. If you are performing slower or faster, we are not generating the enough perfusion that we are looking for, and we mentioned in the beginning. The fourth part is the recoil. So what do we mean by recoil? When we are doing the chest compression, it's very important to keep one part in your mind, that when you compress the chest, you are squeezing the blood from the heart in order for the blood to reach the brain. But there is very important part as well that you have to release. You need to give the heart a chance to fill with this oxygenated blood in order for the heart to work properly. So both phases are important. We do the compression and we do the release. It's part of the criteria of a high quality CPR. The last one is the surface, which means that we need to make sure that we have a flat surface when we are performing the chest compression for the patients who suffer from cardiac arrest. So how we can assist in ZOLL? With our AED devices, we can assist the first part with the position, then with the depth, the rate, and the recoil. Everything can be seen on the screen in here, on the little screen where you can see the depth and the rate, the recoil of your patient. And the position can be easily seen on the pads once you apply them on the patient. We cannot assist with the surface, but that like straightforward, you just put them on a flat floor or like table or anything just to make sure that they are on a flat surface. So as a recap, what is the parts of a high quality CPR or high quality chest compression? So as we mentioned, we need to start the chest compression as soon as possible. If you see someone in front of you who just collapsed, the first thing you need to check is the pulse. But like, I don't think everyone is a BLS certified. As long as you have the ability to do the chest compression for that patient, please do the chest compression as soon as possible. Deliver it on the lower half of the sternum. So the first part is the position. Make sure to do the depth between 5 and 6 centimeter, the rate of 100 to 120, and then allowing the chest recoil so the heart can fill with the blood and perform the compressions on a firm surface. So that's the first part of the treatment or of the assistant of the patients who suffer from cardiac arrest as a lay rescuer. The next part is the defibrillation. What is the defibrillation? Definition of a defibrillation itself, it's the use of the electric current to stop any irregular or dangerous activity within the heart muscle. So as we mentioned, usually we have the normal rhythm of the heart. It starts from a specific point which is called the sinoatrial node, but during cardiac arrest, we see that there is more than one point that cause this rhythm to start, which is considered arrhythmia, an irregular rhythm, okay, abnormal rhythm. And this is how it looks. This is one of the very common shockable rhythm that we have. How does it work? So once the abnormal rhythm is stopped via the shock, we give the opportunity to the heart muscle and the sinoatrial node to start on its own, but in a normal way. Why do we need to defibrillate early? Why do we need to defibrillate in the public areas? Why just not wait for the EMS service to arrive and do so? So the EMS response time is usually different from one country to another. And I believe in Kenya, it reached up to 45 to 1 minute for the EMS service to arrive. And if you look in here, with each minute delay of a defibrillation, it reduced the ability of the survival to discharge by 10 to 15 to 12%, which means that with each minute, if we wait up to 40 minutes, we are decreasing 0.5% of the chances of survival for that patient. And it usually goes higher than that. What happens if we do the opposite? What happens if we defibrillate the patient as soon as possible? So if we defibrillate within 3 to 5 minutes of the collapse, we increase the chances of survival with a 50 to 70%. So you can see the difference, how extreme it is if we wait for the EMS service or if we take the chance and assist that person directly. Here we have another study where they implemented the AED devices or the automated external defibrillated devices in a public areas in Italy. So they decided to do a study where they implemented these devices. They didn't do any clinical training for the people on the streets, and they calculated the chances of the rate of survival for the out of hospital cardiac arrest. And as you can see, there was a tripling in the survival rate of the patients who suffer from cardiac arrest only by adding the AED devices in public areas and allow the lay rescuer to use these devices. The nice part about the AED devices that it shows you exactly what you need to do step by step. So once you open the device, it will tell you to check the pulse, let's say, or it will tell you like attach the pads. It will take a second to do a rhythm check to check if you need to shock the patient immediately or do you need to do a chest compression. So as we mentioned, not all the patients who suffer from cardiac arrest will need a defibrillator, but all of them will need the high quality CPR. Why? Because not all the rhythm that the heart present are considered shockable rhythm. So we have only two shockable rhythms, which are the ventricular fibrillation and the pulseless ventricular tachycardia. The other rhythm that we have, as you can see, all of these are non-shockable rhythm. And in this case, the AED device will read the rhythm and advise you to start the chest compression. And that's why the pad placement is important. The pad placement is not only about the giving the shock, so it's very important to make sure that we shock within the right range, but by applying the pad in the right way, you will know where exactly you need to place your hand to do the chest compression. So this is the shape of the pads, and as you can see, it shows you clearly where you need to put your hand to do the chest compression, where to attach the frontal and the lateral pads, and if you want to use them for the pediatric population, how you can do this as well. Why is the pad placement is important? As we mentioned, the first part is for the where to place your hand during the chest compression, and the most important part for the pad placement is when we give the shock, we need to make sure that the current will go through the heart muscle. It will not go through any other vital organs. It will not be beneficial if we defibrillate the spleen or we defibrillate the stomach. That will be completely useless. What we need to do is defibrillate the heart in order to stop the abnormal rhythm and give the heart a chance to start on its own normally. So in here in the non-shockable rhythm, I know you have seen this on like different TV screens, movies, whatever. They always shock the patient when they have a flat line during series, but that's not the case. This is considered a non-shockable rhythm. Here we have the out-of-hospital cardiac arrest chain of survival. This is the 2025 recommendation of the AHA. As you can see, they start with the recognition and emergency activation. The second part is a high-quality CPR, so it has a chain on its own. And this is our main focus because, as we mentioned, all of our patients who suffer from cardiac arrest will need a high-quality CPR, but not all of them will need the defibrillation. Although we need to defibrillate our patients in some cases if they have a shock abort, but the high-quality CPR remains the fundamental for that part. Some other numbers or percentage that we have from the AHA. So the first one in here, so 9 in 10 cardiac arrest victims who receive a shock from an AED within the first minute, they survive. 9 out of 10 people who receive the initial shock from an AED, so they don't wait for the EMS service, they survive. The bystander, they do CPR about 40% of the time, and even less for the AED or shocking the patients. And lastly, your chances of survival while waiting for the EMS, it decreased by 10% with every minute waiting without initiating the CPR. Lastly, in here, as Professor Douglas mentioned, like you cannot do any damage for anyone when you are using the AED. The only damage that you can do if you hit them on the head with that device. So the AED is manufactured in a way that it's safe for the patient. Unless they are suffering from a sudden cardiac arrest, it will not hurt them at all. And thank you.
So, as Dr. Lara said, ZOLL is a medical product manufacturer, and I'm just going to take you through 2 of our AEDs that we have. The first one being the AED Plus, which is our legacy flagship AED. So just to take you through some of the features that our AED has, as we mentioned before, CPR seems to be the most important. And that's where ZOLL came in, and we have CPR help integrated into the defibrillator. So what this means is that when you're pushing, and if you're not pushing hard enough, the device will actually tell you to push harder. As you can see on my screen over here, on the bottom left, you can see that the bar graph is not reached at the 2 lines. The 2 lines actually signify 5 to 6 centimeters or 2 to 2.4 inches. When the rescuer does have good compressions, the device will also tell you good compressions. This is very important as we're all human. We can't measure how deep or how shallow we're actually pushing on the device. So we have a bar gauge as well, and also an audible metronome. This again comes to the music that otherwise we would be playing in our mind to have the right rate. So if we were doing 70 beats per minute, the device will actually beep, and the rescuer can follow the beeps to bring their rate at a higher rate between 100 to 120 beats per minute. Our CPR D-pads on the AED Plus is a very innovative design, as we have a one-piece pad design. This means, as you can see on the bottom left of my screen, you don't have separate pads, so it makes it a lot easier to apply the pads to the patient. And we have a peel in place application to help preventing mishandling as well. If you look at the top right of my corner of my screen, you can see a red landmark or red plus on the pad. This is to help you to know exactly where to place your hands when you are doing CPR. Our pads have a 5-year shelf life as well, which is an industry-leading shelf life of 5 years. And we also have, where this red plus is, we actually have an accelerometer, a sensor inside the pad, and that's how we're able to give you CPR feedback. So it's actually measuring the distance that the pad is traveling when you're pushing. So one of the main things that we need to think about when we are establishing an AED program is cost of ownership. And that's where ZOLL actually has the lowest cost of ownership, and the AED Plus has the lowest cost of ownership. As you can see, in a 10-year cost of ownership with adult-only pads, we have the lowest cost of ownership compared to any of our competitors as well. This is also due to we use Duracell 123 batteries, which are easily available in most camera shops. Surgilabs as well, we stock the batteries, so it uses 10 of these batteries. Our pads as well have a 5-year shelf life, whereas most of others would be like 2 years, and you would have to change the pads. So this increases the cost a lot more. With the AED Plus, we also have a high visible readiness indicator, which is a green tick on the AED, which you can see as well outlined in red with the arrow on the far right picture. This is actually because the device checks itself weekly, which you can also program it to do it daily as well. And the green check mark means that your device is ready to rescue. So it checks the pad life, it checks the battery, as well as the internal circuitry of the actual device. So to summarize about the AED Plus, we have real CPR help, which is very important, as how can we know if we're doing well or improve if we don't measure. So the fact that we can measure how our CPR is, we can auto-correct as well. The CPR D-pad, which is included in the device, has clear landmarks to show you exactly where to place your hands when you're doing compressions, and long-lasting consumables. We also have the ZOLL AD3, which is our newer device as well. As you can see, it looks a bit more modern. It has a color screen as well. We've taken a lot of feedback from our clients as well while developing this product, and it enhances the features that it offers to rescuers to give them more support and more confidence during the rescue. So again, the same as the AED Plus, we do have a compression depth indicator, although with the AD3, we have it in color as well. So again, if the rescuer is not pushing hard enough, the device will actually tell you to push harder. So we have both visual and audible prompts. As you can see on the picture over here, you can see that the light pink is above the 2 lines of the 5 to 6 centimeter mark. So this also tells you what your depth is. And when you do good compressions, you can see that also the color changes and it becomes a darker purple when you're between the 5 to 6 centimeter mark. This is very important because during cardiac arrest as well, everyone's nervous, and the device actually helps to calm down the situation as it tells you exactly what to do. The other really great feature about the AD3 is, like Dr. Lara presented as well, that we have to, time is a big factor. So even reducing the pause time between how the AED is analyzing to check to see if you have a shockable rhythm or not is very important. So we have a rapid shock analysis with the AD3. As you can see at the bottom, you can see that the CPR cycle in blue, this is when you're doing CPR. So the device is already the baseline ECG. So it's already kind of analyzing your ECG. When it tells you to stop CPR and don't touch the patient, it's already now confirming what its analysis is, and then tells you to deliver a shock. This actually reduces the pre-shock pause to under 5 seconds, which is brilliant. Whereas conventional AEDs would take much longer. As we can see as well above, that it would be around 9 to 10 seconds or more. So another unique feature about ZOLL AEDs in general is that we have pediatric support. And this is because ZOLL believes that children are not just little adults. So we have a child-specific energy delivery as well that does not replicate adult energy. And this is the amount of joules that we shock the patient with. Also on the device, you will notice that we have a button as well on the bottom right, which is what you press if you do have a child patient, and the device automatically goes into pediatric mode. The voice and text prompts will also inform the rescuer that pediatric pads are in use. And on the screen, it will also show you exactly how to place the pads. As we saw in the previous slide as well, on the pads itself, it will also have diagrams so that you will know how to place the pads. It then goes to the second picture, which you can see, where it will actually tell you, don't touch patient and start CPR. So it guides you step by step on exactly how the rescue should go. Now, for those of us who have AEDs in our businesses or in our hotels or anywhere in the public access area, we know that generally you need to have 2 sets of pads. You need to have an adult and a pediatric pads. So the unique thing with the AED3 is we have the CPR unipads, which one pad can be used for both adult and pediatric. So this means that you do not need to stock 2 different pads. The CPR unipads also have the industry-leading shelf life of 5 years, which means less maintenance and lower cost of ownership. The device will also report when the pads are due to expire, which is very important as well, because sometimes we leave our AED and we're not sure of the expiry until sometimes it's too late. So this device will actually tell you if your pads are expired, if your batteries are almost depleted. Of course, with being our newer device, it is Wi-Fi integrated. So this means that your device can actually automatically send an email to your program management software in the event of a failed test. Remember that our device does a weekly test as well. So this report can actually go to your system management, where whoever is in charge of the AED will get an alert if there's a problem with the AED. This comprehensive report will also be sent to your program dashboard, including pad expiration and battery power. The really good thing about the AED3 is, and this is where we come to again, are we just running in a marathon or are we timing ourselves as well? A good example of how we measure. When we measure in, let's say we're running in a race and someone is timing us, that's how we measure that if we're getting better. So the same thing is you can actually download the case after, and this has up to 2 hours of recording as well. So you can actually go through the whole situation later on and see how the event went. And we have this in our own software, which you can download through RescueNet, event summary or case review via Wi-Fi or even USB. What we need to know to summarize about the AED3, it has the enhanced real CPR help, which includes the full color display with vivid rescue images for every cycle of the rescue. We have a CPR cycle timer as well, which tells you the time elapsed as well for CPR, and also the compression depth with a bar gauge, which is also in color. We have the unique integrated pediatric support, which is really important, and Wi-Fi connectivity, as well as the same as our other device, long life consumables, which increases readiness by reducing the frequency of maintenance that we have to do on our AED. So when we look at the 2 products, I mean, both of them will give you the rate, depth, release, and velocity and pause of the rescue. The AED Plus has graphic icons which has a light which will light up to take you through the chain of survival from call for help, place the pads on the patient, start CPR. Whereas with the AD3, it's a full color rescue images which will come up on your screen. The AD3 also you can configure it to store up to 2 languages as well. So for example, you can have it in English as default, and also you can have Spanish or another language as well. So again, we can see over here with the 80 plus, you do need pediatric pads as a separate option, which has a 2-year shelf life, whereas the ZOLL 83, you have the uni pads, which have a 5-year shelf life, and you can use them for both adult and pediatric patients. So which AD is the best choice for you? Well, both of them have almost the same features. It also just comes down to, of course, budgets and what your actual needs are. I mean, if it was my personal choice, if I had an area where I had adults and pediatrics, I would definitely go for the AD3. As the cost of ownership, it's a newer device as well. But the AD Plus as well has been quite robust. We have units in Kenya which have been there since 2007, and they're still going. All we've done is just change the pads and batteries, which is something to say about how strong they are. And the same thing with the AD3 as well. So as we can establish, of course, there's many different AEDs in the market, but not all AEDs are made equal, especially when it comes to CPR feedback. If you have any inquiries, please take note of our contacts. If you'd like us to come and visit and help you to start your AED program as well, we'd be more than happy to talk to you about it and to give you the best advice for what is actually needed for your institution. Thank you.
Thank you, Mr. Kunal, for the clear insights on the kinds of AED and providing clear specifications between AEDs Plus and AED3. So we'll move to our Q&A segment. And if you haven't already typed your question, please go ahead and drop it in the chat box so our speakers can clarify on anything. So I see Dorothy Nyabuto has asked for a clarification on the depth aspects during CPR for an adult, a child, and an infant.
So according to the AHA, there is a difference between the depth according to the age population. The idea of the depth is to be 1/3 of the chest size, which comes as a number 5 to 6 for adult, 4 to 5 as a pediatric. We don't have a specific number for the neonates, but they have a specific criteria of doing the chest compression, not the conventional one, like the one that we do with like 2 hands with pressing on the chest. For the adult, we do like the hold around. So we grab their chest and then we do the 2 thumbs chest compression criteria for the neonatal population.
Thank you so much, Dr. Lara. I hope Dorothy Nyabuto, it's now clear.
Yes, I'm contented with the question. Thank you.
Vivian, can you go ahead?
Yes. Before we conclude, I see a comment here from Chris. A very informative session. Thank you. Just a reminder to everyone that this webinar will be edited and uploaded to the WSPAK YouTube channel. So before then, please subscribe and be on the lookout for this webinar. Anyone who registered for this webinar online, you don't receive a direct link. You'll also receive a certificate of participation in your email. So please also be on the lookout for that. Now, should you need any support from Surgilabs, please, he shared the contact details here. I hope you are able to take a screenshot of that. But if not, we'll also share it in all our internal groups. So this is a message from our chair, Workplace Safety Professionals Association of Kenya. He says, if Kenya is to save more lives from sudden cardiac arrest or heart attacks, we must expand AED access. We must empower people and bystanders so that they're able to act and prioritize strong CPR skills in every workplace and every public space. The science is clear, as Lara has presented, and now it's our responsibility. Sophie, back to you. Thank you.
You're welcome, Vivian. So as we come to the end of today's session, I'd like to appreciate each one of you for your time and for your engagement. It has been a great session, and I'd like to greatly appreciate Dr. Lara and Kunal for the depth and clarity that they've brought to today's conversation, and to all of you for being part of it. I hope that we will take these insights into our workplaces, our homes, and to our communities. Because as Dr. Lara had mentioned, time is a very great factor when it comes to saving lives through CPR or by using AEDs.
A question from Harriet.
When buying the AED device, are you given support training on using them? Yes, this is actually one of our greatest passions as well. We're not just there to sell you the device and drop it off. We actually love doing trainings with you. So from some of our other customers as well, if you look on our Instagram as well, you'll see we do offer the training and support for this. We also work with certain training schools, MedSwipe being one of them, and they also offer first aid training, BLS training, and the ACLS training. So we work quite closely to the training companies as well as us. When we deliver the device, we actually teach you how to use the ZOLL AEDs in specific. So yes, this is a big factor for Surgilabs and also for ZOLL, is we love to train as much as possible.
Yes, I hope you're satisfied by the response from Kunal. I think we'll start with Lara and the rest of the team from ZOLL.
I want to thank you all for taking the time to attend this webinar. I hope that you guys learned something new during this session. The idea of the webinar is to know that we have the power in our hand to help our colleagues and our friends in this critical times, because we want the people who suffer from cardiac arrest to survive, and not only to survive, but to survive with good neurological outcome, which means that they survive, they go back on their legs, and they practice their life back as normal. We do have the power in our hand. We don't need to be a healthcare provider in order to assist. We can do that by simply following what the AED is recommending. By having the device in our facility, this can be doable. Thank you again. And if you have any more questions, please feel free to reach out to us. And thank you.
Thank you so much. I'm sorry, today it seems my camera is not working so well, so it switches on for a bit and then switches off, but I'll say hello, so at least you can see me now, and it's gone. But I would just like to thank everyone for taking the time to be with us today. And, it's about empowering everyone to have the knowledge and to be confident as well about using AEDs and why we should have AEDs within our organizations. I think this is more a humanitarian thing as well, not just to wait for laws. But yes, if you have any inquiries or if you're not sure about anything, please do reach out to us. We're more than happy to come and visit you and also help you start your journey on your first aid and your AED programs as well. And I'd like to thank WSPAK as well for organizing this. This is one of our first webinars that we've done in the public access area in Kenya. So thank you so much to all of you, the team, and I hope we will have some more of these sessions. And that's it. And thank you so much to Dr. Lara as well for heading this webinar. It was very informative. And I'm still learning as well a lot of new things. So that was brilliant. Thank you so much.
Thank you so much, Lara and Kunal, for your sentiments as we close the session. For now, I think we are prepared for anything, and we will apply whatever we have gained from this session in case of such unfortunate events. Thank you so much, everyone, and may we enjoy the rest of our day.